It would appear that a lot of places that were initially hit the earliest, and that would be the West Coast, have definitely hit their peak, and their numbers are coming down. And some of those communities are starting to relax some of their social distancing. California, notably, yet is not relaxing any social distancing at all. They have a little bit further to come down on their mountain before they're ready to do that. Some of the hospitals in those areas that were hit hardest are actually starting to share some of their ventilators and other medical supplies with other areas now in the country. And that's a very good sign. So the big urban centers in the U.S., particularly New York, looks like has hit peak, but after their peak, they're seeming to have a longer shoulder, if that makes sense, and their cases per day numbers are coming down more slowly. But it does seem like their hospitals aren't quite so overwhelmed now, and the number of new admissions in those hospitals is starting to decline. I'm sure they would like them to decline quicker, as we all would for them, but they are coming down, albeit slowly. Some of the other areas in the United States, including New Orleans, seems to be doing better as well. Detroit still struggling some, and both with new cases and with hospitalizations. I think all this in summary for the U.S. says is that different places are in different timelines, and some places have already gotten kind of slammed and are coming down. Some places have not been slammed at all and are just sort of perking along, and then other places still have the potential to become a problem and have their case numbers go up and have their own little epidemic in their own place. Social distancing and sheltering in place is clearly working in these areas. No ifs, ands, or buts. So here in North Carolina, our numbers are also coming down as a state and in most of our communities. So in Charlotte, the new cases per day are coming down. Hospitalizations are coming down some. Again, everyone would want them to come down quicker, but at least they're coming down at a rate. Here in our area, in the Triad, as I've described in the past, rather than having a mountain of cases and going past the peak, we're more on a mesa, that sort of flat, high plateau. And we're kind of perking along with that, with a low number of cases per day in Forsyth and Guilford County, and in the Triad area at large. And our hospitalizations, new hospitalizations, seem to be just perking along. If anything, maybe there's been a little bit of a decline in cases from last week. I won't say we're past peak, because you have to have a mountain to have a peak. Maybe there was a mound that we went over last week, and a little bit more time and we'll know how meaningful that's going to be. But we're doing well here, and our social distancing is really working, and our sheltering in place is working. And again, I gave a big shout out to all of us as citizens in our communities here. We have avoided a huge problem here because of us as citizens, and because we're doing what we need to do to keep transmission of the virus at bay and from giving it to person. Let's bring it home to you guys. Every epidemic is nothing but a series of a million little mini epidemics that come together, and you're doing your part to keep transmission down in your community, in your neighborhood, and potentially even in your own household. So keep it up. We're doing a great job. Another shout out to our kids. Our kids, again, have taken a big brunt of this. They're the ones who don't get graduation. They're the ones who are missing their friends. And the social milieu is really important for kids. And so tell your kid today, thanks, because they're sheltering some burden too. So where do we go here from now? How do we get off our mesa and the triad? How do we get off of and out of our epidemics that are past peak in our cities and in the state? Well, we're working on that. We're closer to solutions, I think, than we were a week ago, and definitely closer than we were 2 weeks ago. I know here in Winston-Salem we've extended our shelter in place for what, 3 weeks, I think. Basically, so it'd be like the second week of May, somewhere in there. Other cities and counties have done the same in our area. We're waiting to hear from the governor on this and what we're going to do as a state. As I said last week, you have to weigh two things. You have to weigh safety and viral transmission and the epidemic on this hand, and then you have to weigh our economic viability on this hand, because certainly we won't want to get back to work and be able to be doing the things that seem more normal. When we do relax our social distancing and sheltering in place, I think it's going to be a graduated process. So it won't be all at once, all at one. We won't wake up one morning and hear, okay, life's normal again, because it still won't be, because the virus is still around. And we have to be careful to not let it recrudesce or resurge again. Because once we relax our shelter in place, then the virus is going to try to push its way back again. And so if you do it in a more gradual way and in a controlled way, you're going to make that likelihood less. So what might that look like? Well, it might be that some businesses might be able to open before others. We'll see what that list looks like. It might be that some activities will be able to come back before others. I think the ones that are going to be later on the list are going to be things that involve large congregate activities. What does congregate mean? Is where a lot of people come together, and things like sporting events, and unfortunately maybe our places of worship, depending on how many people would be there. You might see limitations still put in place on how big a gathering can be and what social distancing during that gathering might look like. Will restaurants come back? Probably. There may be somewhere in the middle as far as how we come back. Again, I'm kind of guessing, because there's a lot of people putting input into how this might look. But you may be going back to a restaurant where the tables are 6 feet apart, which is good news, because you'll get better service. More waiters, less people, always a good ratio. But we'll have to wait and see how that happens. I don't really see much relaxation occurring at all until the end of April, personally. And I wouldn't advocate that we do that until the end of April. I think the communities that have gone out to the middle of May are the ones who are on the safest line, and that's where my recommendations would be. I think we'll know a lot more by then. So what do we do between now and the middle of May when we relax our social distancing and sheltering in place? Well, there's a lot of work to be done. I think I mentioned last week, it's kind of like going down a safety checklist before taking off on an airplane. And you need to make sure that everything is in place. For us in healthcare, we have to make sure we have enough PPE. What's PPE? Personal protective equipment that we use to examine and take care of patients who might have an infection. And then the second thing is that we have to have more availability of testing. Our testing availability in the Triad is increasing every day. And I'm going to come back to that in a minute for us specifically in our area. We will need this testing to be able to identify people who have infections and then put that person in isolation at home, if that's the best place for them, and then quarantine their contacts, which means people who have been in contact with that person will be spending 14 days more watching Netflix. So this is part of our strategy, I think, to get out of this. is because rather than quarantine the whole community of Forsyth County, for instance, what we will be doing is identifying the sick people and isolating and quarantining their contacts. And so it'll be a smaller segment of people. But our communities and our citizens are going to have to be ready for that, because it's again 14 days staying at home. More if you're a contact of somebody who has COVID-19. But those tests have to be available, and we have to have the people trained at the health department and such in order to track down those contacts. Some people have been seeing that there's apps on phones to be able to help with contact tracing. A little bit of privacy issues maybe with some of that, but public health takes privacy into account for everything. And so I'm not sure that that's a big problem for those apps on the phones. The other thing on the checklist that we need to have is a community ready to do the relaxation of shelter in place at the right time and be adherent to it still. So again, it's probably going to be at least a few more weeks yet to endure this. The good news is that it's working. And then we'll start to relax, but we want everyone to relax in a controlled way together and be good citizens about how that's done, which means paying attention to it. I tell people that we've done a great job with it now. It's worked. It's kind of like we've gotten 3/4 of the way through a good basketball game, but the score is still real close. If you're Duke, do you think Coach K is going to let up and just let it go and say, hey, we played a good 3/4. All right, we'll just kind of relax now and let it go now? No, Coach K is not going to say that. He's going to finish that game. And otherwise, the first 3/4 are for naught. Apologies to all the UNC fans, by the way, or the Wake fans. So I've been getting a lot of questions, things about details still on where we're at and where we're going. Let's talk a little bit about testing and testing in our area. So at Wake Forest Baptist Health, we now have in-house testing, which means we're not having to send it out. We have the capacity to do all of our inpatients and our ED patients right now, and healthcare workers. Starting next week, we're going to be able to increase that capacity to doing more people, and this will include patients who might be older, over the age of 65, and or have other underlying health conditions that have a respiratory illness, a flu-like illness with fever and or cough, that they would be able to be assessed and then tested if thought to be needed. Not everyone needs to be tested. We're not going to be opening up testing yet for everybody. We just don't have the capacity. And as we've talked about before, if you're otherwise pretty healthy and you think you have the flu, it could be COVID, but doesn't really matter, because you could just stay at home and put yourself in 7 days of isolation. And then as you're at 7 days, if you've had 3 days of improving health, then you can leave isolation, and that's going to work for almost everybody. Vulnerable patients are the ones who may be in nursing homes, ones with a lot of underlying health conditions, or older or infirm. And for those people, it helps the doctor take care of those people if they have a diagnosis and what's going on. So those are going to be the next priority group. We also want to make sure that people who live in group homes and or people who are in like dorm-like situations and living, if they have respiratory symptoms, that they get tested, because we have to do special things in those group settings to make sure other people don't get it. So that's how we're going to be testing next week. And I think all of the healthcare facilities are ramping up their testing. Is testing going to be available at a point of care yet in your doctor's office? Doesn't look like it. Not yet anyway. And those tests are have to be done in such a way that people without a lot of training or background in laboratory medicine can do them, and most doctors' offices aren't quite set up for that yet. But as time goes on, I think we'll have more office-based testing in the future, and that would be a good thing. A lot of the news about testing using blood tests, serology. What does a blood test measure? It measures your immunity and an antibody. An antibody is a molecule in our body that attacks the foreign agent, such as a virus, attaches to it, and then gets it out of the circulation or gets it out of the airway or out of the lung. And we can measure those antibodies. Presumably, if you have antibodies, it might mean you're exposed to have been exposed to COVID-19. Some things about antibody testing, though, is it takes a while for the antibody to come up. From the time you're infected to the time we can measure good levels of antibodies is probably at least 3 weeks. So it's not really that helpful when you're sick because you haven't mounted that antibody response yet. It's more helpful in knowing whether you have been infected in the past. The other thing we don't know about those antibodies is how well do they work? How well do they protect you? We need to find that out. And so we do studies, and we need to do some studies on that. And then the third thing about that antibody is how long will it last? So if you get COVID-19 today, will you be protected in a year? So first we have to find out how protected you are, and then if you are protected, how long that'll last. So we have some science to do, and that science will be going on through the summer. We at Wake Forest Baptist Health will be participating in such, and I think you may have been hearing on the news about a large survey, we call it a serologic survey, that we'll be doing, measuring antibodies in people to see how many people have been infected in our neighborhood and maybe how well that protection works. So be looking for that as we go on. Other things I'm asked about besides testing is masks. So we've been asked to wear cloth masks in public. Some grocery stores are requiring masks. Other places aren't requiring masks. What do these cloth masks do for us? Well, they're basically, if you have COVID-19 and you're in that stage before you're sick and have symptoms and know it, which could be 24 hours beforehand, there's about 17% of people might shed virus before they actually have their symptoms. And so if you wear a mask, that keeps your respiratory goblets from getting out there in the environment. Wearing masks is more important when social distancing isn't possible. So for those more crowded markets and stores where it's harder to stay away from people, places that see a lot of people where it's really more crowded and there's more people traffic, they're not really necessary outside. In your own home, you've already kind of exposed that area, so you probably don't need them in your own home unless there's someone in your home who's sick, and then that person who is sick should be wearing the mask because it keeps their goblets to themselves. Some hospitals in the region might be asking you to wear a mask when you come in the future, so if you're a patient or visitor to the hospital or have some business in the hospital, you should bring a cloth mask with you in case you're required to use that when you've come in. The aspects about visitors and patients coming in hospitals, so we won't be relaxing our visitor restrictions until we're coming down the slope of our mesa more. There's still some virus being transmitted in the community. And so we still need to keep our patients safe. We still need to keep you safe as a visitor. And we need to keep our staff safe. So we are still going to be limiting visitors until the shelter-in-place orders are starting to be relaxed. And then like everyone else, we're going to be relaxing visitor restrictions in a graduated and safe way. We don't have a timeline for that right now. But we will still be doing visitor restrictions for a while, as I think all of our healthcare facilities in the region. We coordinate this and do it together. So, and I know it's tough if you have somebody in the hospital or a loved one, and it's tough to not be able to be there for them, and it's tough for them not to be there, for you to be there for them, and we really understand that, but we have to keep everybody safe. The emergency department, if you have an emergency, as the phone call says, call 911, right? Or if your emergency isn't quite as much of an emergency, but you have to visit the emergency room, as let's say while social distancing you're doing batting practice and you break your wrist, you can be safe going to the emergency department in any hospital in the area, because all our hospitals, we take measures to keep patients who might have COVID separate from patients who don't. So the ED is still a safe place for you. So if you need to go to the ED, go to the ED. If it's not an emergency and you're sick, maybe it's with fever or cough, call your doctor first and see if you really need to go. No one wants to go to an emergency room if you don't need to be there. So, and then lastly, when you are using a mask and cloth masks, there's a few things about it. If you're going to be taking it on and taking it off all the time, it's best just to leave it on. Because if you get the goblets from your respiratory tract on your mask, and there happens to be a virus, any virus there, and then you're messing with it and taking it on and off, then you get it on your hands. So, and then after you've taken your mask off, wash your hands, because then you get it off your hands, and it goes down the sink, or it goes into the sanitizer. And so that's the right way to do it. And you probably don't want to be mucking with your mask or touching it a lot or messing with it, although I know it's hard to do because they're not always comfortable. But don't mess with it if you can. And then lastly, so if you remember last week, I asked everyone to help me out with a personal thing that my wife, Vera, who's also an infectious disease doctor, wanted to give me a haircut. I wasn't so sure about that. And so I asked everyone to vote. And so here's the votes. Out of almost 800 people who voted, 431, 55% said let it grow, be a hippie. And 45%, 355, said to get the haircut. So I talked to Vera, she conceded the election, and said, you know, I really didn't want to cut your hair anyway. And she said, you know, I'm pretty busy, so I got other things to do with my time. So until social distancing is really let up, you will be seeing my hair grow. So bear with me on it. So with that, if there's any questions, I'd be happy to take questions. Otherwise, I think we covered most of our issues.
You mentioned the Mesa as opposed to a peak.
Yeah.
Do you expect that to continue, or do you expect any sort of peak in the future?
So will our Mesa continue? Yeah, I think it will. I think it'll start to come down gradually. It may already be coming down, starting to gradually, but you know, when it's a Mesa, it's a little bit hard to know your changes in elevation. So it'll come down gradually. What I don't think we're going to see, unless social distancing is released all of a sudden, I don't think we're going to see a big peak in our area. And man, isn't that good news? I mean, yeah, who wants to be overwhelmed with an epidemic? No one wanted to be like New York. We felt for them, but we didn't want to be like them. And I really don't see that in our area at all. So hopefully we won't have a peak. We'll maybe have a little molehill. I don't know, but I don't see a big peak in our area.
And I think a lot of people are, I don't know if frustrated is the right word, but there were, for example, protests in Michigan yesterday and that kind of thing. Is it still important for people in these next few weeks until there's official word just to remain vigilant? Yeah,
so yeah, I mean, the protests that we saw in Michigan, I'm not sure how patriotic those protests were. I'm not really a political person, but yeah, I mean, like I was saying, we're 3/4 of the way through the basketball game. Let's be like Coach K. Let's not let up on this virus. And so, yeah, a few more weeks, 2 to 3 more weeks. I know it's not fun, but why do something 3/4 of the way through and then let go and blow the game? We don't want to do that. So yeah, a few more weeks. I think we're through a good majority of it, but a few more weeks. Let's be steady.
Doctor, with the cloth masks, is there a way to clean them? Do you throw them in the washing machine? Would you spray them?
Yep, your cloth mask, I would throw it in the washing machine. Yeah, the detergent, hot water, detergent, that's what's needed. And in a dryer afterwards is fine. Here's a chance to give a fashion statement too, right? With the different masks. We'll see how that goes.
And I know the big concern has been the places where older people stay, the retirement homes. What have you guys been doing to help them deal with this stuff? I know we have a bunch of those in our area.
Yeah, so retirement homes and nursing homes. So so we're working together with the county health departments with our nursing home populations. For those of you who have loved ones in the nursing homes, you know it's really been tough because one of the things we do there is limit visitors too, because we don't want people bringing it in. We screen our staff going into those areas to make sure they're not sick. And then people with respiratory infections, we test them quickly. People who are becoming new to the nursing home, so if you're a new nursing home resident, you might be spending, depending on the individual home, 14 days in a certain wing, and then moved into the general population, so on and so forth. Retirement homes, so like we call them assisted living. They're a little bit different because most people have their own rooms and there's not as much congregate activity. They're being encouraged to social distance as well, and a lot of their activities where they would all come together, have been more limited, and so that we don't get groups of people together. And again, these are people we would like to test if they get symptomatic.
Is that kind of a place that, even if they're not symptomatic, maybe like test everybody in one of those places so we know who's got it, who doesn't?
Right, so that's a good question. Would we take a facility and just test everyone to see who's got it and who doesn't have it? So we don't, so asymptomatic people without symptoms, there's only really certain things that would prompt us to test them, because as I said in the past, a positive test, it's hard to know what it means because we don't know you're going to get it. Negative test doesn't necessarily mean you won't. So we would not be doing that unless there was an outbreak in that facility. So let's say we found out, oh my gosh, there's 12 people who've gotten COVID in facility X. Then we might do that. And that was done with the nursing home outbreaks in Seattle. We've done a few of those here in North Carolina, in the nursing home outbreaks. So we haven't had a nursing home outbreak in our area here. I should probably, knock on wood, cross my fingers, throw salt over my shoulder, because we don't want that. But yep, they're. And then sometimes there might be certain instances where we might test somebody before a surgery, where the surgeon has to go up into the airways, and we want to make sure they don't have it because there's a big aerosol generated with that. But other than that, we should probably not be testing it. Oh, women in labor will get tested, I think, starting next week, at least in our facility. I think other facilities might be doing it already or will be. And the reason why is that labor is if you've been with somebody in labor or you've gone through labor yourself, you know it's an aerosol generating thing, because you're encouraged to make the noises and stuff that you need to release your energy, and so people will be tested, I think, before that. Any other questions? Every week, the news gets a little better, doesn't it? I think. But just to remind people, we're in this for the long haul, and we will need to make sure that we get out of our epidemic portion of this, or get out of our first wave, and then start planning and making sure that if a second wave comes along, that we're ready for it, so we can stomp it down before it gets to be a big one.